Ranking question. You are a Foundation F2 doctor on a general medicine rotation. During the ward round, the consultant asks you to prescribe meropenem for a patient, Miss Akhtar, who has pyelonephritis. You notice that Miss Akhtar has an allergy to ertapenem, and you know that meropenem can also cause allergic reactions in patients with this sensitivity. The consultant has previously reacted angrily to being questioned by junior doctors. Rank, in order, the appropriateness of the following actions in response to this situation. 1 equals most appropriate, 5 equals least appropriate. E. Raise your concerns directly with the consultant who made the request. C. Consult the on-call pharmacist for advice on whether it is safe to prescribe meropenem. D. Discuss your concerns with one of the registrars to get their opinion. B. Inform the nurse who will administer the medication about your concerns. A. Prescribe meropenem to Ms. Akhtar as instructed by the consultant. Correct ranking E, C, B, D, A rationale. This scenario emphasizes the importance of patient safety and effective communication within the medical team. The best action is to directly express your concerns to the consultant who requested the prescription. Option E. This ensures the consultant is aware of the potential risk and can reconsider the prescription in light of the patient's allergy. Consulting the on-call pharmacist, option C, is the next most appropriate step, as pharmacists are experts in medication safety and can provide valuable advice on potential drug reactions. Informing the nurse, option B, about your concerns is important, as they will be the one administering the medication and should remain vigilant given your concerns. However, it is less effective than directly addressing the prescribing decision. Discussing your concerns with another senior doctor, option D, is acceptable but not as effective as addressing the issue with the consultant who made the initial request. Finally, prescribing the medication despite your concerns, option A, is the least appropriate action as it jeopardizes patient safety and disregards your professional responsibility to ensure safe medical practice. Ranking question. You are a Foundation F2 doctor on pediatric ward. You are waiting to begin the afternoon handover with your colleague Annika, who is on call. Annika is bleeped 3 times in quick succession by the nurses on the neighboring pediatric ward. Annika swears under her breath before leaving the room to answer the bleep. You and a colleague overhear the conversation in which Annika is confrontational and rude, shouting at the nurse. Rank in order of appropriateness the following actions in response to this situation. 1 equals most appropriate, 5 equals least appropriate. A. Ask Annika if she would like to talk about the nurse's requests and why she responded in the way she did. B. Ask your colleague if Annika's behavior is out of character. D. Telephone the nurses on Annika's ward to find out why they needed to bleep her in such quick succession just before handover. E. Discuss the incident with Annika's educational supervisor. C. Ask one of the F2 doctors in Annika's friendship group to discuss with her how she speaks to the nurses on the team. Your ranking. A, B, D, E, C. Correct ranking. A, B, E, C, D. Rationale. This scenario is about coping with pressure at work. Maintaining good working relationships within the MDT is crucial to optimal patient care. The GMC states that an important part of good medical practice is the timely identification and addressing of concerns. Option A addresses the above situation most appropriately. Speaking to Annika directly allows you to explain that her above behavior was unexpected and inappropriate. It also demonstrates that you are available to support her if she is struggling and explore any issues that may be affecting the way she is conducting herself at work. Providing guidance and support are integral to being a good member of the team. Option B demonstrates a willingness to explore the issue and understand whether this is a one-off or a repeated issue which needs more urgent escalation. Option E is somewhat appropriate, escalating your concern to someone in a pastoral and mentoring role to Annika. Option C is similar but less appropriate. Annika's fellow F2S are not employed in a mentoring capacity. It simply passes on the issue without dealing with it. Option D is the least appropriate, as it may be seen to support Annika's behavior.